Alright, so I'm kind of hoping this is the last one that we have to do. So we've got just a few more that we need to talk about, but most of them are pretty short and not really that complicated, hopefully. So let's get into that. The next group that we're going to be talking about are these sex glands, and there's specifically two, one for female and one for male. The one for female are the ovaries, and then, shockingly enough, the male are testes. So hopefully we feel comfortable with those. Now, those glands are pretty important. I mean, obviously the ovaries are important because that's where eggs are produced, and for men, that's where sperm are going to be produced. So not only are they going to be directly related to reproduction, but they're also going to be areas in which they've got hormones that are going to be produced as well, that not only deal specifically with the reproductive areas, but also generate something which are called secondary sex characteristics. We mentioned a little bit with aldosterone, and testosterone is a specific type of aldosterone. Anyway, so secondary sex characteristics are essentially things that define you as a man or a woman, but are not directly related to reproduction. So things like for men would be having a deeper voice, again, the body hair, one of the things mentioned, yeah, stuff like that, like a more prominent Adam's apple, things like that, that are definite to men. Whereas in women, that's going to be wider hips, breast development, higher fat ratio, yay for us. Anyway, stuff like that are going to be secondary sex characteristics within us. So, obviously, they're, these types of hormones are present in all of us. I mean, we still have testosterone, even though we're not male, but they're most associated with the testes and ovaries, depending on your gender. Okay. So, most of the hormones that are associated with male reproductive system or male sex hormones are called androgens, which I think is interesting because androgynous sort of means sexless, and yet we have androgens being sex hormones. So kind of an interesting little paradox right there. So the most important androgen is going to be testosterone, and that's going to be, again, produced in the testes, and it's going to promote secondary sex characteristics in men, or if too much amount in women, it'll promote them too. It's going to have an effect on the libido. Then it's also going to affect sperm production. So ideally, the more testosterone you have in your system, the more eggs you will be, or the more sperm you'll be able to produce. Okay. Now, in women, we don't really have high levels of testosterone. Instead, what we're going to have is estrogen and progesterone. Estrogen is responsible for female sex characteristics, and it's produced in the ovaries. It's going to stimulate mammary gland development, so, make us have a bigger chest. And it's going to help cause menstruation, and then also to just help with regular reproductive organs. So it essentially, what's going to happen is that estrogen triggers the uterus to get ready to take a fertilized egg. So it's going to kind of start that preparation to get ready for fertilization. Yeah, and then it also helps with implantation of an early embryo. Interestingly enough, it also helps keep calcium in bones. So that, along with calcitonin, I guess, works with that. Interestingly enough, it says here that estrogen is also produced within the placenta. I never knew that. Kind of interesting little thing. All right, so that's estrogen. And then we also have progesterone, and that's sort of like the equivalent, or female equivalent of the testosterone. What it's going to do, well, it's a preparatory hormone that's going to help prepare the endometrium for pregnancy and helps maintain the corpus luteum once conception and implantation occurs. Okay, so basically what's happening is that within the uterus, you've got a lining within there, and that's where the fertilized egg is supposed to kind of meet up against and start to form and fuse. So progesterone is actually going to prepare the endometrium for fertilization. And then it's also going to help kind of with the other linings and connectors with it. Now, progesterone will actually cause spontaneous abortion if it's being dropped. So if it's what is necessary for the bonding of the embryo with the uterine wall, it makes sense that if that hormone level drops too low, that it will actually have the spontaneous abortion or miscarriage, essentially. So progesterone is really important during pregnancy. The other hormone that's going to be produced in the ovary is called relaxin. And this one's actually a really important hormone when women are about to give birth. Sorry, I get pretty dry throat. Anyway, so relaxin serves the purpose of actually relaxing the connective tissue. You think about the fact that we have the pubic symphysis, which is again that cartilage in between the two pubic bones coming together. So we've got cartilage there. Not only that, but that's something pretty big to be coming through between our legs. So it's kind of helpful if you're a little bit more flexible within the hips. So what's going to happen is that the relaxin is going to start softening the ligaments within the area, especially the pelvic ligaments for fetal delivery. And then it's also going to help with the dilation of the cervix during pregnancy or during labor. The problem that you're going to come across with relaxin is that it's not just produced during labor. It pretty much starts being produced, I want to say within the second trimester, but I'm not specifically sure. But it does start getting released early on, which means that some of their connective tissue is loose. So if you're doing things like joint mobilization or range of motion with pregnant women, just realize that the tissues that would normally act as support structure are weaker now, so that they're not going to be able to withstand great force. So when you're doing range of motion stuff, you need to be really careful not to take it too far, because those ligaments aren't as strong and tight as they should be. In fact, usually you just don't want to do too much of it at all. Okay, so that is relaxin. Now, within the testes, again, we mentioned we have testosterone in there. Yeah, way to go that.